beautiful people, you're welcome to Nesvika Show, and I am your favorite host, Nesvika. We are celebrating the International Nurses Day all over the world, where nurses are being celebrated for their incredible job that they are doing. And as you all know, I happen to be one of those nurses who are celebrated. This is the Happy International Nurses Week from the 6th of May to the 12th of May, and we are not exempted. Today with me in the studio, I have an amazing nurse who is here to teach us something interesting. In our lives, we have all heard or we have had encounters with nurses. But today, Nurse Agnes is going to tell us who a nurse is. She's going to enlighten us about so many different things about nurses. And I believe that you are going to learn a lot. Therefore, you want to watch till the end of this video to learn something new. So join me as we welcome Nurse Agnes to the show.
Hi, Nesvika.
Hi, Nurse Agnes. We are happy to have you once again on the show. So, just like our viewers, we're expecting something interesting from you. It's always a pleasure having you on the show because we always get to learn so many things from you.
Thank you so much. Thank you.
Okay, so today I know that you have been an outstanding nurse in your profession, and today I know that you have prepared something really interesting for us. What are you going to be talking to us today about?
Okay, Nesvika. So, as you earlier said, we are celebrating our Nurses Week. Nurses Week is a period where we'll be celebrating nurses all over the world for their hard work and for all the effort they put in to save lives and to make sure that we attain good health. So I'm just going to be sharing with us what is nursing, who is a nurse, the qualities and the responsibilities of a nurse, and most importantly, the challenges that nurses face.
Oh, I know.
Yeah.
Okay,
So as we know, nursing, we have all been hearing nursing. We also have juniors and families, friends, relatives who wants to do nursing, and they want to ask you or come for orientation like, big sis, what's nursing? So we'll just tell them that nursing is a profession in a healthcare sector which deals with maintaining, attaining, and help in the recovery of the sick. That's to maximize or to reach optimum health for all those that are ill.
okay.
Yeah. So it's just a profession in the health sector. Let's not forget that in the health sector there are other lots of professions. Yeah, so nursing happens to be just one, and it's so prestigious.
Oh, you can say that again.
Yeah. So secondly, I'm going to be telling us who is a nurse. I am a nurse. Nesvika is a nurse.
Of course, I am a proud nurse.
So who is a nurse? A nurse is a person who has undergone training in an institution and has attained certificate and is practicing under a hospital with the authorization of a nursing council governing that country. And for Cameroon, we have the Cameroon Nursing Association. Okay, I will take that again. A nurse is someone who has undergone training for a particular given period of time. And in Cameroon, we have colleges where they grade nurses. We have state registered nurses, we have nursing assistants, we have HND nurses, we have nurses with bachelor's degree, we have masters in nursing, which from there they start specializing. That's when you get a pediatric nurse, a surgical nurse.
All the different specialties.
Exactly.
And then you are forgetting something. Doctor of nursing practice.
Exactly. Exactly.
We are evolving.
We are evolving. Definitely, we are evolving. So, what's the purpose of nursing? Okay, the purpose of nursing now is it deals with collaborative care of all age group. As a nurse, we don't neglect some other persons. Like, no, you are a child, I'm not supposed to practice my nursing skill on you. Or if you're sick and you come to the hospital, I say no, because you're a child, you should go home, let your mother take care of you. No. As a nurse, their purpose is to collaboratively take care of the sick or ill, those who are ill of all ages, regardless of their tribe, regardless of their sex, their colors and everything, to make sure that they attain maximum health.
So what you're telling us is there is no segregation when it comes to the nursing profession.
At all.
No bias, nothing. You have to be neutral, no taking of sides. And I like the word you use, it's a collaboration, you know, because a nurse is actually going to need at some point in time to collaborate with the lab scientists, to collaborate with the doctors, to collaborate with the physiotherapists, with many different sectors, just as you mentioned, that in the healthcare system, to ensure that this patient gets maximum care that they deserve. Okay.
And also not neglecting, it shouldn't be only individuals, it entails communities at large.
Oh, so you are talking about holistic care.
Holistic
a nurse
care.
provides holistic care to both the patient, to their families, and to the communities at large. Okay.
So we are going to go now to the qualities of a good nurse.
You want to hear that.
Definitely.
You want to note these qualities down so that when you see something which is different from it, you're going to be able to identify that no, this is not the quality you should follow. Remember that as we provide you with care, you are also there to keep us on check to make sure that we are doing the right things at the right time. So, Nurse Agnes, please, we are interested to hear these qualities of the nurse.
Okay. So, firstly, when we talk about qualities, a good nurse must possess this. A good nurse must be a good communicator. A good nurse must be a good communicator. Why a good communicator? Because you deal with information, you have to communicate several things, many things to your patient or to the carer. So you will not want to, through your means of communication, change what has been sent to you initially. Because miscommunication has caused a lot of problems.
You're right.
Yeah. You can be asked to tell a patient this, and the next minute you are telling the patient something else, which can even lead to a patient's death. So a good nurse must be a good communicator.
And I would just like to add that when we are talking about communication, we are not just looking at you passing the information across to the patient, because we all understand that there are two types of communication. We have the verbal and the non-verbal communication. So as you're passing the information to the patient, you too have to be sensitive enough to get information from this patient. It could be through their facial expressions, it could be through the words they speak, it could be whatever it is, you should be keen enough to get that information. Which means that as a nurse, you have good listening skills and good observational skills. If not, you are going to miss out a lot of information that could help to save this patient's life.
Yeah, that's correct, Jessica. Also, a nurse must be a good leader. You must possess good leadership skills. Why good leadership skills? As a nurse, at that particular time where you have a patient, you are acting as the superior of that institution in the absence of that superior. You are acting like, let me say, like a shepherd leading
the sheep.
You have to tell them what to do at that particular time, and that is when the quality of leadership have to come in. And if you don't have it, I bet you face a lot of problems.
Ladies and gentlemen, I don't know if you got what Nurse Agnes said. She said the nurse serves as a shepherd leading the sheep. You cannot lead if you don't know the way, which means that as nurses, we also have to be knowledgeable. Which means as nurses, we have to know what we want to present to the patient. Because if you don't know where you're going to then, trust me, you're going to be a very bad leader. So today we are learning something interesting. We have to possess good leadership skills.
Also, as a good nurse, you have to have a critical thinking. That's critical thinking. If you are faced with an emergency, and at that point in time, you have to put actions in place. You don't have to be running helter-skelter. You first of all have to think, what should I do to remedy this situation before calling for help? If you don't think critically, I bet you are going to miss that. So as a nurse, critical thinking must be a top priority.
Okay, so we think on our feet.
Yeah.
Immediately we see something, our minds are thinking already what to do. We are trying to look for one or two things that we'll put in place to make sure that we are saving this life. Remember that in her introduction, she made us to understand some of the main responsibilities of a nurse, which was to promote health, to prevent disease, and to also promote rehabilitation of these patients. So how can you promote this health, or how can you prevent illness or deterioration if you cannot think fast? Trust me, a minute in this profession can save a life, as well as that same minute can be all what it takes to transit from this world to the next world.
Okay, so I'm going to go now to the responsibilities.
Okay.
So we are going to do with that qualities, the qualities that are listed. For now, okay, so number one responsibility of a nurse is an educator. Why an educator? Because once you're in your office, you have to tell your patients, oh, this is what you're going through. You educate them. These people come to you and they are ignorant about what is happening to them. If they know what is happening to them, I bet you they will not be in the hospital.
You're right.
But because they don't know, that is why they come and meet you, and you have to explain to them very well what is happening to them, what is going on, what do you think can remedy their situation. So a good nurse should be an educator.
And you know, sometimes what actually baffles me is when I see maybe a nurse picking up a fight with a patient carer. It's true, we are all humans. Sometimes we may act out of character. But then, if you remember that you are an educator, if you remember that though these people are knowledgeable, though they are learned in their own fields or in their own walks of life, they basically have no knowledge, little or no knowledge when it comes to health issues. You are the one who has gone to school for almost 4 years. You are the one who has studied this thing day in, day out. Therefore, you don't expect them to understand or to behave the way you are. Remember that when people are sick or when people care for people, not only the patient is a patient, because we consider even the family member to have psychological problems. When we begin to incorporate all of this into our thinkings, into our practice, we see that the care that we provide to our patients is of higher quality. So what are the next responsibilities as a nurse?
So one of the other responsibilities as a nurse is a confidence. As a nurse, you are the confidence both to your patient and to the patient carer. To your patient firstly, there are some information that we call confidentiality in nursing. It's not every information about the patient that you have to tell the family members. We have to respect patients' confidentiality. So as a nurse, it's not everything that you see that you just run to tell the patient carers and hospitals. You have to respect their confidentiality and keep their information secret until if the deems it necessary to tell the family.
Or she gives you the go ahead.
And you see, most nurses carry a lot of secrets. I tell you, those people are very secretive. Yeah, because they act as confident. They keep a lot of secrets, and it's good. Also, a nurse acts as an advocate. You are a nurse, you have a patient. From what I said before, as a nurse, you are just part of the branches in the healthcare tree. So you have other collaborators that you work with. You have the doctors, you have the laboratory technicians, you have a whole lot of
other collaborators.
Yeah. So if you have your patient as a nurse, you are the one to advocate for that patient, which means you try to seek what is good for the patient. If a patient is supposed to do this, and if something is supposed to be done in the patient, and because the patient is incapacitated, the patient cannot do this, you have to run to make sure that what was supposed to be done that has not been done should be done on the patient.
So you're acting like maybe you're trying to notify other healthcare team workers to be like, okay, at this point in time, this is what we need to do on this patient. Is there any reason why we are not doing it? What do we need to put in place to make sure that these procedures carried out on this patient? So it means unlike maybe the pharmacist who applies theory in dispensing their drugs, or maybe the physician who writes out orders so that others can carry out these orders that he has written, the nurse is actively involved.
Yes.
Actively involved in the care of these patients. Okay.
Also, the nurse acts as a counselor. As a counselor. It's very important and should not be neglected. You have patients with all kinds of problems, all kinds of illness. They are going through a lot, and they need a shoulder to cry on. They need someone to tell them that, oh, you are going to be fine. Oh, this thing is going to pass. You act as a counselor. You try to counsel them that just be a little while, just wait a little while. Everything will be okay. From then you start building up their morals. If you are that type of a nurse who doesn't give a listening ear to your patient, I bet you are getting it all wrong. You're getting it all wrong. Because what might even bring down that patient if you don't counsel the patient on a regular basis will even be depression, not even the illness that the patient was warded in with.
Sometimes all patients need is just somebody they can talk to.
Exactly.
You might not be able to provide the solution at that point in time to them, but just you being able to listen to them is all what they need.
Exactly.
Yeah, at least they get the feeling that someone cares. Someone still cares about me in this world, and they get that strength to carry on, to push forward. You know, many a times, you know, nurses provide this counseling to these patients, you know, and then they end up being empathetic. You know, there's one quality about nurses that I like, being compassionate. You know, there's a difference between being empathetic and being compassionate. You can be empathetic, you sympathize, you feel the patient's pain, but you do nothing about it. And when we talk about being compassionate as a nurse, this is a quality I love so much. When you're being compassionate, it means I feel the pain you feel and I take an action. I take a move to see that this problem that you have is being solved. You know, that is what I always tell other colleagues, or young colleagues, other colleagues on the field, that if you want to be a good nurse, always put yourself in those patients' shoes. If this was my brother, if this was my sister, what would I have loved that it should be doing? If I were in this situation, what quality of care would I love that should be offered to me? You know, when you start thinking like that, there will be a change. Okay, let's admit.
Okay, so that's all for the responsibility.
That cannot be. We you know, the list is inexhaustible. The list of our responsibilities, of our roles are inexhaustible.
Yeah.
Nurses are all of what Agnes have mentioned,
and more.
Even more.
Exactly.
They are more.
We are nurses and more.
Yeah. So once again, what do you want to say to the nurses out there as we are celebrating the International Nurses Week?
Okay, I would say that after I'm done with the challenges that nurses face.
Okay.
Alright, so as a nurse, there are a lot of challenges that we face in the field. A lot of challenges. And number one of that challenge that cannot even go below is long shifts. Very long shifts. Our shifts are hectic and long. You come to work and you work 12 hours, you're working 14 hours, not just sitting and doing nothing, you work as in you work. And since I'm really young in the profession, let me say, I just, I can say I really admire the senior colleagues. Like at times I will ask them that, how do you people do it? Like you leave work with your responsibilities that you have at home. Like the shifts are really long and hectic. That is one of the challenges that we have. Number two, we have emotional involvement. Just like Ms. Ika said, empathy and sympathy, being compassionate. One of the challenges that we have as well is that being emotional. Like you have a patient and with the patient's condition, your emotions can take over you, take a hold of you, and you don't even know how to control yourself. Also, we have exposure to a lot of chemicals, a lot of infection as well. Yeah. But for that, even though it's a challenge, but we always have our personal protective equipment.
Yeah.
And should in case accident happens, there's always a measure to tackle the accidents, to prevent damages. We also have poor treatment from patients. I'm not going to forget that one. So we have poor treatment from patients, not only patients, patient carers as well. Yeah, poor treatment in the sense where the patient and maybe their carers often they abuse you. They always don't think you have done enough.
They always want more.
Yes, they want more. They want more. So it's really challenging because after you as a nurse, you have worked your long shift and you have given it your all. At the end, it's end up with insult. method and non-appreciative work is really challenging. And also, lastly, we have the physical challenge. You have to be lifting patients for some people who don't have carers to lift them and all the like.
I would just like to handle one of the challenges you mentioned. You remember you said maybe the old colleagues or those who have stayed with more experience on the field, you wonder how they are able to incorporate work and their personal life and things and still get everything done within the same 24 hours that you and I have. I think that one of the qualities of the goodness is being able to manage time properly. Because if you're able to manage time properly, you're going to get lots of things done. Remember, a nurse is a manager. We don't only manage the affairs of the patients or the patient caregivers, but we also manage our own affairs and the affairs of the institution as well. So as nurses, all we need to do is learn to be better time managers, you understand? So if we learn that skill, we'll realize that everything will be in place and will not waste so much of our time, and at the end of the day, we will not feel so exhausted because we have everything planned out. And talking about lifting patients, I think that as we evolve in Africa, to be precise, in Cameroon, as we evolve, things are going to get better.
Definitely.
And I can assure you that the amount of stress we have in a referral hospital or in a hospital can never be the same as the amount of stress you get in a district hospital or in a primary health care facility. Definitely, you're going to have less resources there or less sophisticated medical resources, so you're going to need to do lots of manual labor than in a referral hospital.
Okay, let me give my last word. Okay, so I usually hear these slogans that they say, "Not all heroes wear capes." Definitely, that should go for nurses. They are heroes who are underestimated and underappreciated. They are the backbone of the hospital. They put in a lot of effort, and I think they deserve so much more accolade than the ones they have been given. And indeed, they are all heroes and heroines. Yeah, exactly. And I just want to wish us all a happy Nurses Week. Nurses Week should not end between the 6th of May to the 12th of May. I think we should wear our uniforms with pride. We should pick up our forceps, we should pick up our working materials with pride, because we are lifesavers and we deserve more accolade. And if they don't give us, we are going to give ourselves, because definitely we are doing a great job. So I want to wish all of you out there happy Nurses Weeks, and for those young ones who are aspiring to be future nurses, the field is open. You will learn a lot of things. It's so exciting, contrary to what is being said. Nursing is just the best. Happy Nurses Week. Thank you so much.
Thank you, beautiful people. I hope you've learned a lot from Nurse Agnes. And just like one of our senior colleagues says, nurses are the heartbeat of the medical profession. Without us, the hospitals will not function as efficiently as they do. So, to all the nurses out there, we are wishing you a happy International Nurses Week, and we want you to know that you are amazing in what you do. You're lifesavers. You should carry this profession with pride. You should work with your heads held high, because you are just amazing. Thank you for all the amazing work you do, and I hope you enjoy this program so much. Once again, I am your favorite hostess, Ika. Thank you and bye-bye. Oh, if you haven't subscribed, please do so, and don't forget to turn on the notification bell so that you'll be the first to be notified when we drop our videos. Thank you. Bye-bye.
Bye.